Nandini Gupta and Maria Bucco, welcome to Mindworks and Conversation, and really excited to talk with you both about the Arts and Medicine Symposium taking place in Florence, Italy, May 21st to 24th. And I'm really honored to be part of the faculty. I'm just curious about the choice of Florence as a place to do this. It seems like it's a pedagogical choice and not just a nice location. So, what inspired you to develop this symposium in Florence versus a Marriott somewhere?
Nothing wrong with a Marriott somewhere. But Tony, thank you so much for having me and Maria on. It's an honor to be part of this, and hopefully we can get the message out to a broader audience about the work that we're doing. I chose Florence truthfully for two reasons. The first reason was that another member of our board, Kristen, she actually works in Florence. She is an educator and has in Florence itself. And so during my narrative medicine training, when I was on a Zoom call with her, I asked where she was while we were both sipping Prosecco, and she happened to tell me where she was. And at that time, I had formed my foundation, but hadn't chosen a location yet. And a light bulb went off when she told me that she was in Florence because I thought of the Renaissance and I thought of how the Renaissance taught us that seeing clearly was both a scientific and a humanistic act. And so when I went to Florence to visit it to see if this could be an ideal location for the symposium, I don't know if everyone has been to Florence, but it is just the most stunning city. I would argue one of the most stunning cities in the world. The setting itself can be part of this symposium. And so I chose Florence really intentionally because it reminds me that healthcare workers and physicians, we also emerged from that same
Same
idea
idea.
that science and humanistic medicine should be together. And so that's why I chose Florence. I think it's an amazing space to learn. Not only are you learning in the galleries itself, but also being immersed in the city.
Yeah, there's something about being immersed in beauty, which I think heals the mind and the soul. So that seems to be a part of it. What problems in contemporary medical education are you trying to address through this symposium? What do you think?
So, from my perspective, I think one of the things that's so healing is connection,
Hmm.
connection between the healthcare provider, whether it be the physician or the nursing staff or any of the ancillary staff, that connection, because in medicine, we deal a lot with human frailty, I mean, people come in for their routine visits, absolutely, and those are fun. But a lot of times they have an issue, they're afraid, they have a problem, and just the connection that gets the bonding that occurs and the clinician's ability to make that connection, I think it's strengthened by practicing narrative medicine.
Mm-hmm.
And that has been my experience. I started my certification during COVID, and I got to tell you, that community really sustained me during COVID, especially the weeks that we couldn't go in and see patients. And I was doing my coursework and getting on the Columbia University, workshops 3 times a week. It just was sustaining and helped me to continue to connect with my patients, even when I had to examine them on Zoom. So there's just something about the pedagogy that really creates that space for connection, especially at a time when human frailty is just so palpable.
Mm-hmm.
Yeah, I agree. I had the same experience that narrative medicine, the CPA course, which I started, I guess, in 2019, and then it led into COVID, really saved my life in many ways, literally. And it taught me to read, and I was an English major. It taught me to read and also to more closely listen to people. But Marie, you bring up this issue of frailty, and I would assume you're not just speaking of patient frailty, but also physician frailty in this
Absolutely,
moment of disconnection.
absolutely,
Yeah.
absolutely,
I mean,
And
in
and
medical school, we're taught how to, or in medicine, we're taught how to improve our diagnostic accuracy. We're taught about efficiency and being effective from that perspective. And we're taught not to miss things. We're told, don't miss this, right? These are big things that you can't miss. But rarely are we ever taught how to see, if anything. And I think that narrative medicine in the course, when I was going through it as well, it slowed me down a little bit and forced me to ask questions where I started to see things in a different way. It wasn't just about hearing to pick out a diagnosis. So it was about seeing the patient, actually seeing them for who they were. And then also reflecting on myself, Tony, as you said, seeing me, not only holding compassion for the patient, but also compassion for myself and what I was going through while I was experiencing taking care of people.
So you're talking about seeing not only visually but metaphorically,
Yeah.
enabled to be able to really incorporate the entire patient into, our
Wholeness.
perspective.
Yeah, I don't think contemporary education also does not enough support or, put importance on the healing of just being heard.
Mhm. Mhm.
Just someone, being acknowledged of what their issue is, and being, reassured that they're being heard. We're working on this. We're going to help you.
Mhm.
And the one thing that seems to be missing is empathy towards the learners.
Mhm.
We spend an awful lot of time about talking about empathy towards patients, but rarely have I heard anything about having empathy and curiosity towards the learners themselves. When feedback is given, you did this, you need to correct it, versus really trying to understand the student and their mindset and their thinking. And that was a really interesting thing that you did. Let's talk about that. Why did you make that choice? So we often don't ask students about the choices they make. We want to correct them.
Yeah, I think that I was in the same space that you were. I am a practicing clinician. I'm a cardiologist, and I noticed that we care, which we should, a lot about the patients feeling heard and taught, maybe not taught, but experienced that they should be heard and they deserve to be heard.
Right.
Even during the course of narrative medicine, it was very focused on patient care or the person sitting in front of you. But very rarely do we get the opportunity to talk about how it affects us, how these encounters affect us. We have this moment in medicine sometimes called a debrief
Hmm.
with, I think we all are aware of it, but let's say that there was somebody who had a cardiac arrest and they were resuscitated. The entire team comes to try and bring the patient back to life, to resuscitate them. And then afterwards, there's this moment of a debrief. And usually the debrief is 5 to 10 minutes right after the code, after the patient has gotten wheeled to the ICU. It doesn't always have everybody that was present because some people have to jet off to see other patients, or some people don't necessarily don't know about it or don't have the time to talk. But you're in a high stakes setting still. You're still in the hospital doing this work of talking about how it made you feel and how and the experience that you went through, and it's quite fresh right after.
Right.
And I don't necessarily know, I think it's very good to have these moments of debrief, but it's hard to get to draw people in to actually be vulnerable to share these types of feelings that they're having if they don't necessarily feel comfortable or know how to do it or how to talk about it. And so this is part of the reason why I did it. I have experienced multiple debriefs where everyone is quite quiet and quite silent, and then you bring them to an art gallery or you bring them to an art scenario, and suddenly they are speaking and they are talking and they are sharing. And you realize that if you can bring these kind of questions instead of a high stakes setting to a low stakes setting, using art as a reflective mirror, you can bring out those emotions and actually start to really feel compassion for yourself so that your next clinical encounter or your next code, maybe you'll see it a little bit differently for yourself and give yourself a little bit more grace in making you a better doctor.
Yeah, and the emphasis of the symposium is visual intelligence.
Yeah.
And so I'm really fascinated to see how this emphasis will change people, change their perspective.
I mean, it's visual intelligence and compassionate intelligence, I'll say.
Yes.
Yeah, I think from a visual intelligence perspective, as I said before, and Maria can speak to this as well, I've been taught not to miss things. I've been taught to look for things, but I've not actually been taught how to look.
All right.
And narrative medicine, with its specific narrative medicine questions and the idea of text, fine art, it's stagnant. It's not moving anywhere. It allows you to sit in that space for as long as you want and to look, just to see, to pick up things that you might not have seen if you were waltzing by the painting for,
Right.
6 seconds to make sure you checked off the boxes to see all the work, which we've all done many, many. But I think that the practice of seeing just any sort of thing that we do, if you practice it more, it becomes more innate to
Right.
who you are as a practitioner. And so if I can help people see better using art as the backdrop, maybe with practice over time, it becomes intrinsic to their way of practice. So that, as Maria said before, you walk into a clinical encounter and you see a patient, you have 10 minutes, but you also notice that they're hunched over, and you notice that their chin is down, and you notice that they have nicotine stains on their hand, and you notice that they're not making eye contact with you. Maybe that will change your approach on how you talk to that patient. And so I'm hoping, and what I believe is that art does this.
I'd be interested to see if this changes the equation regarding narrative medicine and its over focus perhaps on verbal texts and not graphic texts. And I think that maybe the reason the focus is more on words versus graphics is that we don't have as much experience perhaps talking about what we're seeing. I'm not sure.
Yeah.
I know for me, a lot of it was what's on the page. Let's pay attention to that. That's important. But now, we're shifting the focus.
Yeah,
Mhm.
there's a really good book actually by Amy Herman called Visual Intelligence.
Visual intelligence, yeah.
Yeah, and it basically breaks down exactly what we're saying, that if we can teach people how to see, it can improve their visual intelligence, which all of us need in all works of life, but we especially need in medicine.
And it's also important to slow down. That maybe you've heard of Slow Art Day.
No, I haven't.
It's been going on for a while, and I participated a couple of years. And it's based on the idea that we need to go, if we go into a museum, let's look at two or three pictures for an hour, not 50. There's been research from people that are monitoring, like the Met Museum in New York, that the average visit or the average person standing in front of a picture is about 40 seconds.
Wow.
And so you go into the Met or any museum and then you're wandering from place to place to place rather than just slow down, apprehend what you're seeing, take it in, and reflect upon it. And I think that's what we're going to be doing.
Yes,
Yes.
exactly. Doing with Maria and Kristen and yourself as well. Not only are we going to have didactic lectures in the morning, but also the opportunity to go to the galleries, and within the galleries themselves, pick 2 or 3 pieces to sit with. I want to emphasize, I know that this is an exciting trip for lots of people where maybe they haven't been to Florence before, and maybe there are certain pieces that they really want to see, and I encourage them to go and see them as well. But I also, during the symposium, encourage them to focus on the 2 or 3 curated pieces so that they can have something that they walk away with. I don't remember the last time before narrative medicine, before the course, I would do the exact same thing, probably spend 30 to 40 seconds per piece.
Yeah.
And I have no recollection a week after as to what I saw, unless I spent actual time with it, being with it, sitting with it, reflecting with it, putting it onto myself. Then I start to have a real relationship with that piece that sits with me and stays with me way after I've left. I don't know, Maria, if you've experienced the same thing.
Absolutely. I've been to the Met, but one of our favorite places that we go to is the Philadelphia Museum of Art. And even taking our children from wee little, and we just love it there. And now, having done what you both described for many years, now when we go, it's like, what room do we want to sit in?
Mm.
And we just hang out in that one room. And it just makes such a difference because you really do see things, even though all these years we've been going, that you didn't see before, and just being still with it, and focusing just on that one room, one piece, one artist. It just really does make a difference.
I have one more question,
Of
and then
course.
we'll stop. This is going to be an international museum or international conference,
Yeah,
and I was wondering from the both of you, what do you hope to learn from others during this experience?
I love that question. I'm so happy that you asked that question because we have participants that are coming from Europe, from Canada, from the United States, from Australia. Um, then the fact that this is our inaugural symposium, I am so grateful that we have people all over the world who recognize the importance of the work that we're doing. So I'm very, very grateful for that. And as we spoke about before, my experience of medicine is siloed to Canadian medicine. And it's obviously very different than your experience in the United States or somebody else's experience in Europe or someone else's experience uh, in in Australia or different parts of the world. And so I hope to understand from this how different cultures use, preserve, or don't have that humanistic dimension of medicine, what they're doing, if they're doing anything, if there is something that they're doing that we can also incorporate into our practice. And as we spoke before, every system faces immense pressure under health with healthcare, but not necessarily every system responds the same way to that pressure. And so if we can understand at the core that we are all trying to make the world a healthier, better place and figure out what works for some people in their countries and what works for others and what doesn't work and what doesn't work. I think that ultimately I'm trying to make this a global movement, bringing humanities into the medical practice so that it becomes a foundational core element of medical education across the world.
Thanks, Nandini. That's a beautiful way of expressing it. And what
Hi.
I know, I'm like, now I have to speak because that was just so eloquently put. And as you were speaking, and what's coming to my heart is just being able to see beyond the obvious and to do that in a worldly community. Now I'm going to start with the tears.
I want to give you a hug.
I mean, just to have this opportunity to be part of this movement to, again, bring together healthcare providers from around the world so that we can together learn how to see beyond the obvious, because it's so easy to go through the review systems, and in an orderly fashion from head to toe, then physical exam and come up with a differential diagnosis. But there's so much more between the lines that's not so obvious until we stop and take that look.
Mm-hmm.
And doing this in community with people from around the world during COVID. I mean, who'd have thought during COVID to meet all these people from around the world for the narrative medicine community?
Mm-hmm.
To be able to do this in person now, it's just going to be amazing, an amazing experience just to show up and be present for this wonderful space that we collectively, thanks to you, Nandini, and your beautiful idea, are going to create for each other. So that's what I'm really looking forward to.
Yeah, Maria, I'm really happy to hear you say that this is a movement. It's not just a symposium. It's not a one-off. That
Mm-mm.
this further evolves the practice of narrative medicine
Yeah.
by doing something a little different, by engaging people in looking at art, taking in the beauty, connecting, finding compassion in ourselves and each other, learning from each other. I can't wait.
I know.
Can't wait.
I just want to say I would not be able to do this by myself. I've stood on the shoulders of giants with Maria, with Kristen, and now with you, Tony. I mean, we are all in this together, going to bring this beautiful symposium together to create a movement for art where it belongs, in the science world. it's not separate. And I'm just so honored that you guys are going to be doing this with me so that this becomes an annual thing. And who knows, the Philadelphia Museum might be on the list in the one of the upcoming years. I would love to, because I've never been, and you guys are selling it to me so well. I have to go see it. So I'm just so grateful. I'm so excited. It's a very intimate symposium, and I think that it works that way. And hopefully, everyone has just as much fun and comes out a little bit more enriched.
Well, thanks to the both of you for being here and to talk about this. And again, I'm so honored to be a part of this movement, and can't
Thanks
wait
for
to
having us, Tony.
Yes.
can't wait to make this happen. Thanks.
Thank you. Thank you.
Take care.
See you again.